I'm Dwayne Brown tonight on KPBS Evening Edition. Requests denied, the latest ruling that clears the way for more than 1,500 new taxi cabs rolling out on San Diego's streets.
And who plays California's lottery games and how much money actually goes to schools? I'm Peggy Pico with a profile of lottery players and why they buy in San Diego. But first, a medical team from San Diego heads to Nepal to help injured survivors. How they plan to do it.
Changing the language in the locker room, the baseball fans in San Diego taking a stand against bad behavior. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. Building on California's ambitious effort to curb greenhouse gas emissions, Governor Jerry Brown set new goals to cut emissions by 40% over the next 15 years. He announced his executive order on Twitter this morning, saying California sets a very high bar for itself and other states and nations, but it's one that must be reached. Today at a global conference on climate change, the governor cited dangers posed by climate change, including the drought and rising sea levels. Brown didn't lay out specifics on how to reach the goal. If approved, his plan puts the state in the lead over current federal targets. San Diego's air quality is getting better. The latest State of the Air report from the American Lung Association shows the county has made significant progress. KPBS health reporter Kenny Goldberg joins us from the newsroom. Kenny, what jumps out at you from this report?
Well, first of all, since the year 2000, this is the first time San Diego has not made the top 10 list of the most polluted cities in the United States, so that's a big plus. And in addition, since the year 2000, the number of days with harmful ozone pollution has declined by 80%. The number of days with harmful particle pollution has declined by 92%. So those are definitely some major achievements.
And how does this report account for these improvements?
Well, the report lists two factors. Number one, California has fairly strict air quality laws. And number two, California probably has more hybrid cars, electric cars, and very low emission vehicles on the road than any other state.
And Kenny, how is the air quality in other parts of California? How do they compare?
The air quality in other parts of California is not good, especially in Fresno and Los Angeles. Those are two of the most polluted metropolitan areas in the United States. So that means that millions of Californians live in areas where there's very poor air quality.
So Fresno and LA, pretty bad. What about improving the air quality situation? What might get in the way?
What's probably going to get in the way, says the report, is climate change. California is already seeing increasing temperatures, and with this prolonged drought, it's going to be very, very tough, the report says, to get any more major achievements in air quality in the near future.
KPBS health reporter Kenny Goldberg. A regional thumbprint finds San Diego's quality of life is getting better in some areas, but suffering in others. The Equinox Center tracks 15 economic and environmental indicators. Several areas improved from last year, including residential electricity consumption and air quality. What folks throw away, how much people drive, and clean water were areas in need of improvement. A San Diego judge has denied a request for an injunction on the city's efforts to issue new taxi permits. KPBS reporter Megan Burke says the decision clears the way for taxi regulators to process some 1,500 permit applications.
That's right, Dwayne. The San Diego City Council voted to open the taxi market to more drivers late last year, and they've been applying for permits in droves. Existing permit holders sought to stop that when they filed a complaint and called for an injunction in March. In court this week, they argue the city should have done an environmental study before approving more smog-producing taxis. The judge called the claim speculative and unsupported.
The judge himself actually said in the hearing before we left that the petitioners were able to offer no authority whatsoever, saying that a taxi project has ever been held to be subject to CEQA.
Now, CEQA is the state's Environmental Quality Act. Attorney Keith Diggs says the Public Utilities Commission has already ruled CEQA does not apply to policies allowing similar for-hire vehicles on the road. And soon-to-be permit holders say they plan to buy low-emission cabs.
Owning my own taxi gives me the freedom to spend time with my family, be off the roads like I am right now, where I'm on the road a lot of times. I'm driving about 70 hours a week.
Changes to the taxi industry came after a San Diego state study found drivers had to work long hours to cover leases for their cabs and were taking home little money. A representative for the permit holders in the case could not immediately be reached for comment. Despite the injunction ruling, a full legal challenge will move forward. Megan Burks, KPBS News.
For the first time, city workers have made San Diego's spending plan into an interactive online tool. Now, a series of pie charts break down spending in the next budget proposal. Click a slice and you can look deeper and deeper into the budget. The city's Director of Performance and Analytics says the budget data can be downloaded starting next week.
There's transparency. The public can engage with their government better. It also allows us to see our budget information in a way we've never seen it before, so that we ourselves can say, okay, let's see how much we're spending in this particular area in these various departments, and maybe there's some efficiencies or some leveraging we can do to do better.
You can see the new tool for yourself at budget.sandiego.gov. The first supplies of food aid began reaching remote areas today of villages in Nepal. The death toll is rising from Saturday's massive earthquake. More than 5,000 people were killed in Nepal. 19 more died on Mount Everest. The other desperate need for this region are supplies for shelter. The quake left tens of thousands of people homeless. A team from Los Angeles is on the ground now in Nepal working on search and rescue missions. Here's a look at their operation tweeted by a federal disaster aid group. The team's job is to help the Nepalese government find and save victims from the devastating earthquake.
It's the right thing. It's a good humanitarian item, and they're in need, and I sure hope when we're in our need that people are going to come help us from all over the country and around the world when we have that need.
The team is one of only 2 rescue groups headed to Nepal from the U.S. The crew will be in Nepal for about 2 weeks. Taking off soon, a medical team from San Diego will be deployed to Nepal to help. Peggy Pico has that story.
A team of 16 doctors, nurses, and support staff from Scripps Health will leave for Nepal in the next few days and stay for at least 3 weeks. Joining me with what the team plans to do are my guest, Chris Van Gorder, President and CEO of Scripps Health, and ER Dr. Mark Alcott, also with Scripps. And Chris, now Scripps has already sent trauma teams, right, in the aftermath of Katrina and in the aftermath of Haiti, right,
That's
to help
correct.
there.
That's
So do you know yet where this team is going to go and who the first likely patients will be?
We don't. Everything's very fluid. The International Medical Corps sends in an assessment team. They actually flew in with the FEMA USAR team, and they've been there for a number of days, not only looking for a location for the medical care, but determining where the mobile field hospital, if it's deployed, would be located. So we anticipate we'd fly into Kathmandu, and then most likely, if the hospital is set up, it would be set up probably at the airport. If not, we could go anywhere in the country.
And Dr. Alcott, so the patients then that you might be seeing then, it's been almost a week since the 7.8 quake. So what types of conditions or medical conditions will you be treating?
We're really anticipating a variety of things, Peggy. Certainly, by the time we arrive there will still be some trauma patients who have not yet been able to access care. So certainly we'll have traumatic injuries, broken bones, crush injuries, wounds to care for. But we also anticipate there will be a large number of people with chronic medical conditions, that will have been become unstable because of the lack of care and because of the stress of the earthquake. And then certainly as time goes on, during the course of our 2 to 3 week deployment, the concern would be for communicable diseases, infectious diseases related to poor living conditions and related to close quarters. So we're really preparing for a broad spectrum.
So maybe contaminated water, dysentery, things
That's
like
a large
that. I
concern.
see. Chris, how does Scripps benefit from sending medical teams like this to disaster areas?
Well, I can tell you morale's up at the organization right now, just with the employees and doctors knowing that we're going to do something as important as this. But most important is we bring back experience. A disaster could hit our community any time, earthquakes and fire being the most likely. We've had a chance now to be in Haiti and see exactly what it's like to work in austere conditions with terrible crush injuries and things like that. We're going to be able to see it again in Nepal. We bring that experience back so we can understand and be able to not only teach it, but if it ever happens here, we're going to be ready for being able to do things when not all the equipment and people are available to help.
And that brings me to a question for you, Dr. Alcott. So certainly running water, things that we take, sterile environment that we take for granted here in the States in good times. Is there special training or preparation that the medical team has to go through?
There is, and we've done an extensive amount of training within the California Mobile Field Hospital. Most of us, though, virtually all of us, have actually had experience either in the military setting or in a deployment, as Chris mentioned, in Haiti after the earthquake there. So we're accustomed to the changes you have to make when you step out of the hospital and into the dirt, quite literally, to care for people. And it's always interesting to see how much you can really accomplish. We love the great facilities we have at Scripps and the other healthcare facilities in San Diego, but you can do a lot of good for folks even with relatively simple conditions and simple equipment.
So as a doctor, why you have a nice ER facility, why are you going over to Nepal?
The bottom line is really this is why everyone on the team and really all of our colleagues at Scripps went into healthcare, is really to take care of people. And day in and day out in American healthcare, there are a lot of things that kind of get in the way of that. And this opportunity to really do, pure care for someone in desperate need, is an amazing opportunity and something that doesn't come along that often. So really, while it sounds kind of simple, is a very powerful motivator for all of us who are involved.
Well, Chris, you've been on the front lines after disaster on that. What's it like being there, helping these people that are so desperate for help with not a lot of resources?
Yeah, it's an incredible experience. I mean, it's even hard to explain. I think all of us, when we see a disaster hit, I'm sure there's viewers right now that are looking at Nepal saying, I wonder what I could do to help. Well, we have the ability to help, and we've gone a number of times, and we have deployed and with our badges, our identification with an American flag on it, and they didn't know who Scripps was, and they could care less. They didn't even know who we are, but they saw the American flag, and you could see them in Haiti. You could see them warm up the minute they knew that the Americans were there to help. And yet when we were leaving, you could actually see the fear coming back on their faces because they knew we were going to leave them alone again. But probably the thing that did it all for me was in Hurricane Katrina, when one of the convention centers was being, the people were being forced to leave again because of Hurricane Rita. One of our team members found a yellow card on the ground that was clearly made by a child, and it just on the front it said "Have Hope," and you open it up and it was unsigned, but it said "Help is on the way." And so that's what people are looking for. They need to have hope because help is on the way.
All right, Chris Van Gordon and Dr. Mark Alcott, thank you so much.
Thank you.
Thank you.
Rady Children's Hospital is launching a new project to find out what causes birth defects like cleft palate and certain heart deformities. KPBS science reporter David Wagner is here to explain.
Over the next year, Rady Children's aims to sequence the genomes of about 200 San Diego newborns with birth defects of unknown cause. The goal here is to pinpoint the genes or environmental factors driving these abnormalities. And the project is going to be led by UC San Diego pediatrics professor Christina Chambers.
Even though they're pretty common, 1 in 33 babies are born with a major birth defect, for most of them we really don't know what the cause is.
Chambers says this project is possible now because San Diego companies like Illumina have brought down the cost of gene sequencing dramatically. This new project is the first effort announced by the Rady Pediatric Genomics and Systems Medicine Institute. It was formed last year with a $120 million donation from the family of Ernest Rady. David Wagner, KPBS News.
Taking a stand against homophobia in sports, baseball fans, coaches, teachers, and Padre players stood together before today's game at Petco Park, pledging to do their part to respect and welcome all people, regardless of their sexual orientation. The nonprofit group Athlete Alley put the event together. Hudson Taylor is the founder and a college wrestler.
In many athletic communities, the language of the locker room is not as inclusive as we know it can or should be. And so certainly there is a changing generation. I mean, there are more athletes coming out, more athletes speaking out, more teams and leagues taking a stand. But this is not the beginning of the end, it's the end of the beginning.
Taylor, who is straight, says LGBT athletes are often marginalized. He says policies need to be changed to make communities feel safe and inclusive for everyone. Deciding how someone would like to be cared for if they become seriously ill or incapacitated isn't a popular topic of conversation, especially among college students, but a program at Cal State San Marcos is trying to change that. KPBS health reporter Kenny Goldberg says a campaign is underway to get students to think about their options.
You see the signs all over Cal State San Marcos. What gives your life meaning? And who should know? The signs are part of a campaign to make students think about what would happen to them if they had an accident or serious illness that left them unable to tell people how they wanted to be cared for. The idea is to communicate their wishes in advance to friends and family. Student Robin Simone says it's not an easy thing to talk about.
It might not come up, maybe over dinner, but it definitely is an appropriate conversation for college students to have.
The topic isn't theoretical for Simone. She recently lost two of her grandparents who had never told anyone what kind of care they wanted if they became seriously ill.
You need to kind of analyze all these things and let your loved ones know the best situation that you would be okay with, so they don't stress over, what would be best for you.
This campaign comes from the Institute for Palliative Care based at Cal State San Marcos. Faculty Director Sharon Hamill says they'd like students to focus on more than just end-of-life issues.
Advance directives and end-of-life is a part of this, but it's really a different mindset to approach your life from the perspective of identifying what's meaningful to you and making good decisions in line with that. And that certainly includes your healthcare decisions.
The campaign, which includes on-campus events, introduces students to the concept of palliative care. That's a medical specialty that emerged in the last decade or so. It concentrates on easing the pain and stress of serious and terminal illnesses. Palliative care specialist Holly Yang points out relieving painful symptoms is just one element.
But we also help people sort of figure out where they are in their illness, frame the medical possibilities along with their values and what is deeply important to them, and then try to package that in a way that people pursue the therapies that fit who they are.
Yang and her colleagues also pay attention to caregivers and family members, who are often one and the same.
It's actually a public health issue that not only do patients need help, but so do their loved ones who are helping to care for them. And so if we can provide more support, in fact, caregivers have a better quality of life. So if we can take care of the caregivers, then the patients get better care as well.
Del Mar resident Santiago Becerra was diagnosed with a particularly aggressive form of thyroid cancer last fall. Becerra says the treatments were incredibly painful and debilitating, and he started to lose hope. Then he had a couple of sessions with a palliative care doctor who visited with Becerra's entire family.
In the process, I was reminded that I had a life. I was something more than just cancer.
Becerra says palliative care helped him realize that while he couldn't control his illness, he could control how he made the journey.
That enabled us to have hope again and to enjoy life and to enjoy the walks by the beach that I used to have with my wife and enjoy laughing with my kids and the simple things in life that are the really important ones.
Faculty Director Sharon Hamill admits palliative care is probably more of a concern to adults than college students.
But when you put it in the context of what gives your life meaning and identifying from a very early age what is it that you want to be about and what's important to you, you then start to change not just individual behaviors but a whole life path.
The Institute for Palliative Care plans to take its awareness building campaign to other Cal State campuses later this year. Kenny Goldberg, KPBS News.
KPBS videographer Nick McVicker helped produce that story.
I'm Judy Woodruff. On the next News Hour, I sit down with Michelle Roberts, the first woman to lead Pro Basketball's Players Association. That's Wednesday on the PBS News Hour.
Who buys lottery tickets? A new report shows San Diego players may not be who you expect. Peggy Pico takes a look at why folks play the lottery, who really wins, and who doesn't.
The California lottery pulls in about $5 billion worth of sales each year. Where does all that money go, and why do so many people play the odds at the cash register? Here with some surprising answers are my guest, Joe Girardi, investigative reporter and data specialist with KPBS partner iNewsSource, and Nicholas Christenfeld, psychology professor at UC San Diego. And Joe, all right, who's the average lottery player here in San Diego?
So my analysis suggests that the average lottery player in San Diego probably looks pretty much like the average San Diego County resident. I looked at the sales of lottery tickets by the income level, the average income level of a zip code. And as it turned out, about 3/4 of all lottery sales in the counties were in middle class or moderate income neighborhoods. Only about 1% were in really poor neighborhoods.
How does that compare to California and the rest of the nation as far as middle class players?
So for California specifically, the California State Lottery actually hired a firm to do a survey recently of their players. And as it turns out, most people who play the California Lottery are employed full-time, and a plurality of them earn between $50,000 and $75,000 a year.
So about the same then?
So yeah, it seems to match to some degree what you would expect San Diego to be, just based on where those tickets are being sold. Now, you also asked nationally. Nationally, the picture is murkier. It's less clear, because there have been studies from different states, different cities, as well as nationally, that try to pin down the question of whether a lottery kind of disproportionately affects the poor. And there's some evidence that it can. There's also been some evidence that people across kind of socioeconomic classes tend to spend about the same amount of money. Of course, if you spend $1,000 a year on lottery when you're making 20 grand, that's very different from spending $1,000 if you make 80 grand.
Sure. So now, Nico, as you like to be called, you research people's habits and motives and things like that. Why do you think people play the lottery?
Well, it seems to me it's not so much really like an investment the way you would put money in the stock market or things like that, where it's not for the thrill, it's not for the pleasure, it's just so that later you have more money. That's a very bad reason to play the lottery. The expected value in the economic sense is almost nothing. That is, you give them $1 in exchange, they give you back nothing. Not just that you're unlikely to win, but even if you win, it's not that great. It's not that great psychologically, and it's not as much money as you thought it was going to be, and so on. So really, it's about the worst gamble you can do. Those roulette tables are vastly better. The poker tables,
the odds.
All those things are better.
So then why do people do it?
So it really is, I think, not so much what would happen if you won. It's what you feel like when you might win. That is, holding the ticket, you're holding the possibility of what you think would be a vastly better life. You're wrong about that, but as long as you think it, that's why it's worth something.
I believe it every time.
I don't have to worry again about car payments or house payments or tuition for the kids or whether I can buy a second pair of shoes, whatever it is. As long as you hold that ticket, you can imagine that blissful life.
So buying hope, it sounds like a little bit, or buying at least a little dream. Nico, let me ask you this then. Are there certain signs that, you know, this is fun, all right, you spend $1, you buy a little hope for the day or something, or a little wish for the day. When do you know if it's become a psychological or an addictive problem?
Well, with all of these addictions, the general idea is when it starts to interfere with your normal life. That is, when you're starting to spend money and not have enough money for food for yourself or your children, or gets in the way of other activities. And that's true for gambling addiction, sex addiction, alcohol addiction, substance addiction, right? That all of these things can be used in moderation without interfering with your life, and that's the way most people gamble. But once it crosses over and starts to interfere with the normal course of your life,
then get some help there. Now, Joe, the California Lottery has been around for about 30 years. How much does the state get from lottery sales, and how much does that fund California schools?
Sure, and I think you know right there, the issue of school funding is very important. When in 1984 they brought the question before voters of, do you want to bring in a public lottery, it was sold to voters as a funding source for public education. Last year, they brought in about $5 billion statewide in lottery sales, and they sent to schools about $1.35 billion of that. Most of the rest went to things like prize money, as well as commissions to lottery retailers, and then what was left was staff overhead at the lottery commission, you know, expenses to keep the operation running.
So a little bit goes to school. Well, I mean, a little bit. I mean, that's enough money. It's just not as a whole bunch of it. Unfortunately, we're almost out of time, so I have to end on this. Do you play the lottery?
I never have.
Never?
If someone gave me a ticket, I would probably hold on to it and bother checking, but even that I might not do.
And Joe, you've won recently on the lottery. Do tell us.
Won, indeed, yeah. So actually, the first time I ever bought a lottery ticket was for this story when I went down to a liquor store that sold them. I got a $3 scratcher's ticket, and I ended up winning all of $4 on it.
See, people win. Joe Girardi and Nick Kristenfeld, thank you so much.
Thanks, Meg.
Pleasure.
Well, things are heating up in San Diego. A mix of sun and clouds expected along the coast over the next few days. Mid to upper 70s, 70 degrees by Saturday. Warmer in the inland valley areas, temperatures in the mid to upper 80s. Sunny in the mountains, temperatures there in the 70s. And it's feeling hot in the desert. Look at that, 100 degrees tomorrow, back into the upper 90s. And here's a look at what we're working on for tomorrow in the KPBS newsroom on Morning Edition. California's neuroscience project, CalBrain, has given out its first wave of funding, how this follows a White House initiative. And on Midday Edition tomorrow, memories of combat, military deployments, and the inner life of an American soldier. Celebrated writer Brian Turner explores these issues in his new memoir, My Life as a Foreign Country. Join us at noon on KPBS Radio. You can find tonight's stories on our website, kpbs.org/evening edition. Thanks for joining us. You have a great night.